this is your midsection. I know, crazy, right? So what this picture is if somebody chopped me through the middle of my body and then had a look at all my muscles. So let's just have a look at this. So I'm gonna put it up this way. I think that works. So this here is your spine, okay? So that's your back. And these two round parts are your rectus abdominis. So your six-pack abs. So that's your front. And then what we've got here in between our six-pack abs is our linear elbow. And notice this is like a normal person. See how the linear elbow still has a gap. Like there's no issue with having a gap, right? But it's a nice firm gap. It's solid. And then coming around, we have 3 sets of muscles. Now you might not be able to see this quite well, but the one that's in the furthest is your TVAs. So that's what we talk about a whole lot. Then the middle one here is your internal obliques. And then the outside one is your external obliques. So we have our rectus abdominis at the front, TVAs in the deepest part of your core, internal obliques, then external obliques. So the external obliques are the ones that you kind of, you know, and you can see. They're here. Then internal, and then the TVAs. Now, do you see how they work? So there's some connective tissue here that connects to the rectus abdominis and your linear elbow in between. So this all connects. And see how they also come all the way back around here to your back muscles and connect with them. So when you engage any of your muscles, they engage the whole system. So remember how I said with your pressure, you're working to protect your spine? That's because all of these are coming in. When you do your exhale, everything's kind of coming in and it's protecting this spine, okay? Because they're all connected. Now, what happens is some people say, I've been doing my TVA exercises and my back really hurts. I don't understand. Well, what tends to happen then, if you pull your TVAs too hard, okay, so if you're doing that engagement and you're really working it hard, it's going to pull on your back muscles here as well because you're engaging. So you're pulling them in, which means you're pulling on your back muscles, you're pulling on your rectus, you're also pulling on your internal and external obliques. And what tends to happen is if your TVAs are weak and you're pulling, your rectus and your back muscles will often take over. Sometimes your external as well. So you're pulling it up and you're pulling it in, but because these are like, oh, I give up, your back muscles will take over and your rectus will take over. And that can cause either the bulging, but it can also cause back pain, okay? So when I say you might be over-engaging, that means you're pulling it so much that you're activating your back. And I think, I can't remember if it was last week or the week before, I talked about putting your legs, so laying your legs up on a chair. So you're at a 90 degree angle. So like, imagine I'm on my back and my legs are up here and they're resting on a chair. Because what that does is it relaxes so that you don't need to hold your legs up at all. So even lying on your back, if you have your knees bent, you're still having to kind of hold your legs up. And it also puts your back muscles in a relaxed position because they're stretched out. So now your back has to do nothing. And it's really hard to activate your back when your legs are up and relaxed. And then you can really concentrate on just activating the TVAs. But you don't need to activate them a lot. You only need to just activate them. Because remember, they're your deep core muscles. So they're the first ones that get activated. So, well, actually, second. The first is your pelvic floor. So when you pull up your pelvic floor, the first 30% is just your pelvic floor. And then when you pull it up further, your TVAs become involved. And then when you pull it up even further, your internal obliques become involved, okay? So they all work together. You can't work one without working the other because of all of this sort of connective tissue and fascia and things that connect them all because it's all one system. So keeping it working, and when you're just working your TVAs, it is a really small movement. And I know we've talked about it, but if you come in here and you pull, so here's my hip bone, and you come in just a little bit further into here, and a lot of people say you should be able to feel this muscle in here sort of pop out. What's actually happening is when you're engaging your TVAs and it will become firm. Then when it pops out, so it starts, you and keep engaging, and it pops out and you feel like that ribbony cord coming up, that's actually your internal obliques popping out. Okay, so once you get to that point, that's you engaged, you're good. You don't need to go any further. Okay, we don't want you to keep engaging and get those external obliques working and then your back muscles working. Okay, so number one, don't over engage. The reason why is because you trigger your external and your back muscles. That can cause issues with your back muscles, but it can also mean that your external obliques get too strong, too dominant, and your TVAs don't do the work that they're meant to do. And we want our TVAs and our internal obliques, which are the ones that people don't do with traditional core work if their breathing isn't correct. We want them to get strong. That's the key. So that was number one. I hope that was interesting.